Vanakkam, welcome to this session of the hand surgery quiz, the fun way to learn hand surgery. Question number 1. Who performed the first successful microvascular anastomosis using a microscope? Julius Jacobson, Carl Olof Nyland, Harry Bunke, or Alexis Carrel? And the correct answer is Julius Jacobson. The beginning of microvascular surgery had three important events. The first was the triangulation method of end-to-end anastomosis described by Alexis Carrel in 1902, and he won the Nobel Prize for this in 1912. The next important event was the invention of the operating microscope by Dr. Carl Olof Nyland and Holmgren at the Karolinska Medical School in Stockholm, Sweden. And finally, the first successful microvascular anastomosis using a microscope done by Dr. Julius H. Jacobson in 1920. Question number 2. At the level of the wrist, the percentage of load borne by the radiocarpal joint is 20%, 40%, 60%, or 80%. And the correct answer is 80%. When the forces are transmitted from the hand to the arm, when crossing the wrist, the load is borne mainly by the radiocarpal joint to the tune of about 80%, whereas the distal radio-ulnar joint, which consists of the triangular fibrocartilage complex and the ulna, contributes only about 20% of the load sharing. The load is then transmitted along the lower end of the radius, then obliquely across the interosseous membrane, and then through the proximal part of the ulna to reach the elbow joint. At the elbow joint, the radiocapitellar joint transmits about 60% of the load, and the humero-ulnar joint transmits about 40% of the load. Question number 3. The posterior interosseous artery flap was first described by Zancoli and Angrigiani, Mascole and Zancoli, Edgar Beamer and Lu, or Yang. And the answer is Zancoli and Angrigiani. This flap was described in 1993 by Angrigiani and Zancoli. Yang et al. Published the forearm free skin flap transplantation and described the radial artery flap in 1981. The pedicle radial artery flap was described by Beamer in 1981 and Lu in 1982. Question number 4. The following were the ancestors of the amphibians, and the development of the limbs began with them: the ray-finned fish, the shark-finned fish, the lobe-finned fish, or the cartilaginous fish. And the answer is the lobe-finned fish. The lobe-finned fish are the sister group to the ray-finned fishes. All the fish that we see normally are the ray-finned fish. The lobe-finned fish are different from the ray-finned fish in that they have paired fleshy pectoral and pelvic fins that are each articulated via a single bone. These lobe fins are not very maneuverable but will be able to support the weight. As you can see, there is a single bone connecting the lobe fin to the body of the fish. At present, there are only two known species of fish representing this family of lobe-finned fish. They are the coelacanth and the lungfish. This is the coelacanth, one of the types of lobe-finned fish, which was thought to be extinct but has been found today in the deeper parts of the oceans. You can see their strong pectoral fins. As development took place, the pectoral fins became stronger, and it is still seen today in the fish called the mud skipper, which can walk on land. Question number 5. The technique of tension band wiring for fractures is classified under co-aptive fixation, stable fixation, rigid fixation, or external fixation. And the correct answer is stable fixation. When we consider fracture management, there are only two options: closed reduction methods and open reduction methods. The closed reduction methods are external immobilization and the technique of closed reduction followed by external fixation or internal fixation. Under the open reduction methods, there are three techniques: coaptive fixation, stable fixation, and rigid fixation. The techniques of external immobilization and closed reduction followed by external or internal fixation and coaptive fixation lead to secondary healing of the fracture. The examples of external immobilization are cast application, splint, traction splint, or fracture brace. The examples of closed reduction with external or internal fixation are percutaneous pinning, percutaneous K-wires, or external fixators. And the examples of coaptive fixation are K-wires, intraosseous wiring, and intramedullary pins or nail. On the other hand, the techniques of stable fixation and rigid fixation lead to primary healing of the fracture site. Examples of stable fixation are interfragmentary screw, tension band wiring, and tension band plating. Examples of rigid fixation are lag screws and plate and screw fixation. Question number 6. The Snow-Littler procedure is a technique used in the surgical reconstruction of hypoplasia of thumb, clinodactyly thumb, claw hand, or cleft hand. And the correct answer is cleft hand. The Snow-Littler procedure basically consists of the following steps: incision on the thumb web to release the syndactylized thumb and the index finger, raising a volar flap over the cleft region based on the volar side, shifting the second metacarpal bone to the region of the third metacarpal bone, erasing the attachments of the adductor pollicis and the origin of the first dorsal interosseous to aid in widening the thumb web, then transposing the volar flap that had been raised to resurface the thumb web defect that has been formed now, and primary closure of the cleft area. Question number 7. Who described the use of the extensor indicis proprius as a donor for opponentsplasty? Theodore Burkhalter, William Burkhalter, Riordan DC, or James Weck Riordan? And the correct answer is William Burkhalter, who described the use of the extensor indicis proprius for opponentsplasty in 1973. Question number 8. The extensor digiti minimi tendon occupies which of the following dorsal extensor compartments at the wrist? Compartment 3, compartment 4, compartment 5, or compartment 6? And the correct answer is the fifth dorsal compartment. Before we see the 6 extensor dorsal compartments at the level of the wrist, let us see the bony prominences. The radial styloid is the prominence on the radial border of the lower end of the radius bone. This forms the volar edge of the first dorsal compartment. The Lister's tubercle is the protuberance on the dorsal aspect of the lower end of the radius, which separates the second and third extensor compartments and also serves as a pulley for the extensor pollicis longus tendon. The ulnar styloid is the protuberance on the dorsal aspect of the lower end of the ulna. This forms the ulnar border of the fifth dorsal compartment and the radial border of the sixth dorsal compartment. And finally, the ulnar head on the ulnar border of the lower end of the ulna bone. You will note that the sixth dorsal compartment is a groove between the ulnar styloid and the ulnar head. The first dorsal compartment comprises the abductor pollicis longus and the extensor pollicis brevis. The second dorsal compartment comprises the extensor carpi radialis longus and the extensor carpi radialis brevis. The third dorsal compartment contains a single tendon, the extensor pollicis longus. The fourth compartment contains the extensor digitorum communis tendons to the index, mid, ring and little fingers and the extensor indicis proprius. The extensor digitae minimi tendon occupies the fifth compartment and the extensor carpi ulnaris tendon occupies the sixth compartment. Question number 9. Sharp erosions on the scaphoid can result in attritional rupture of the flexor pollicis longus tendon and is known as the Mannerfeld lesion. Is this statement true or false? And the answer is, it is a true statement. Sharp erosions on the tubercle of the scaphoid can cause an attritional rupture of the flexor pollicis longus tendon which lies in close proximity. Question number 10. The following are provocative tests to uncover thoracic outlet syndrome except the Allen test, Adson's test, Wright's test or the Roos test. And the answer is the Allen test, which is not one of the provocative tests to uncover thoracic outlet syndrome. The Allen test was described for assessing the blood flow to the hand by the ulnar and radial arteries, and this was described in 1929 by Edgar V. Allen. In the Roos test or the elevated arm stress test, the patient has the arms at 90-degree abduction and the examiner puts downwards pressure on the scapula as the patient opens and closes the fingers. If the thoracic outlet syndrome symptoms are reproduced within 90 seconds, the test is positive. In the Adson's test, the patient is asked to rotate the head and elevate the chin toward the affected side. If the radial pulse on that side gets absent or becomes decreased, then the test is positive, showing the vascular component of a neurovascular bundle which is compressed by the scalene muscle or the cervical rib. The Wright's test is done as follows. The patient's arm is hyperabducted, and if there is a decrease or absence of a pulse on one side, then the test is positive, showing the axillary artery getting compressed by the pectoralis minor muscle or the coracoid process due to the stretching of the neurovascular bundle. I hope you enjoyed this session of the hand surgery quiz, the fun way to learn hand surgery. Please comment on whether you found it difficult or easy, and most importantly, whether you found it useful. And please scan this QR code with your mobile to instantly access the YouTube channel to see the latest in learning hand surgery.